Over the past 5 years, the nursing education programs that have moved to an online format have more than doubled. Welcome back, everybody, to Dr. Sellers Educate. We're happy to continue on our journey and looking at how we should align our curriculum with the CUSIN standards as well as the AACN essentials. And as many of you continue on your journey to achieving certification by NLN as a nurse educator, it also helps us to close our knowledge gap. If you haven't already, go ahead and subscribe to this channel so every single time there's a new episode, you'll be notified right away. You want to go ahead and pull out two resources. First is going to be Billings and Halstead Teaching and Nursing. Second, I want you to print out your study worksheet. Every single time you show up for an episode, we want you to print out the study worksheet, write today's date, whatever date you're watching this episode or listening to this episode, and we want you to write down an objective on that worksheet. The worksheet is really important because it helps you stay focused on your journey to achieve C&E, and perhaps you're able to identify some muddy points that you may have so you can join us during an upcoming master class or any of our review sessions and programs that we provide right here at Dr. Sellers Educate. Now let's go ahead and jump into the content. If you have not reviewed the content from our previous episodes, don't worry, you still have time. We will continue to take a look at the work that has been done by CUSIN already in mapping the AACN essentials. And what we have done is we have layered the NLN Nurse Educator competency in making sure that we are aligning these concepts to help you be a better nurse educator. Okay, so even if you're not on the journey, that's okay. We here at Dr. Sellers Educator are here to support you no matter where you are on the journey. All right, so let's go ahead and take a look at our content. The topic of this episode is Tech Forward Nursing Education. Our goal is that we are aligning these concepts so that you are able to apply them right away. As we think about the CUSIN standards, we know that quality and safety are at the core of the everyday decision-making processes that our nursing faculty are taking, as well as our didactic faculty and ultimately our students. We want our nursing students to be practice ready as they transition into the healthcare setting. So what are some strategies we can use to do that? Well, first we're going to start with our thought-provoking question. Curricular reform is needed to increase utilization of technology to best prepare students for the workforce. Embracing technology is crucial in modern nursing education to do which of the following? We have A, assist in bridging the gap between theoretical knowledge, B, to help increase student performance in the classroom, and C, enhance the use of printed textbooks and resources. Okay, so bridging the gap, increasing student performance, or using printed textbooks. We want to go ahead and take a look now at our crosswalk. Okay, so again, if you want to take a look at the original crosswalk that is on the CUSIN website, you can go to the CUSIN homepage, and then what you will find is the link to the CUSIN AACN crosswalk. Okay, so that amazing work has already been done by our nurse educator colleagues over at CUSIN. So let's take a look at the crosswalk. Let's talk through some of these concepts to make sure you are connecting the dots. So the first column is the category or competency or focal area. In this snapshot, which is 130, we're focusing on informatics. However, you will see that we have now created a document, so you can take a look at the document that you're seeing right here on our screen, where we have done a crosswalk with the nurse educator competencies, the hallmarks of excellence, the CUSIN domains, the CUSIN KSAs, the AACN essentials domain, as well as the teaching and evaluation strategies and resources that you want to use to refer back to when you are reviewing your content. Okay, that will provide additional context for you. So in this episode, we're focusing exclusively on informatics, but we do want you to know that you can find right here in the description a link to this full spreadsheet that includes the crosswalk that we have now completed, aligning the CUSIN competencies with the specific competencies. All right, so let's take a look at how it aligns with first the nurse educator competency. So we have facilitate learning. It's aligned with C&E, C&E novice, and C&E clinical. The expectation is that we're supposed to demonstrate behaviors where we are integrating and utilizing technology to support the student teaching learning process. Okay, and then the next competency is for C&E, functioning within the organizational environment and the academic community, our ability to analyze the impact of social, technological, economic, political, institutional factors on nursing and higher education. What is our role primarily? Well, first, we want to make sure that we understand from a political standpoint, from an economic standpoint, and even institutional factors that may influence the decisions that we make about our curriculum and what content we're teaching, what resources we're using. Okay, so that's how it aligns with this competency specifically. And then the last one is related to C&ECL. Functioning within the education and healthcare environments, we want to be able to teach our students and introduce them starting in the classroom and then making sure they have hands-on experience in the skills lab, the simulation setting, before they arrive in the healthcare environment. We want to think about how we can introduce these technologies in the classroom, starting with utilization of our textbook vendors. So there's so many resources now that our textbook vendors can provide to us. So it starts with having a collaborative relationship, partnering with our textbook vendors or other resources that you may have available. And when we think about our simulation software that we're using, making sure that we are maximizing all of the technologies that are available to us already with our established textbook vendors or other resources that we may have. Okay, so what's next? We want to look at our hallmarks of excellence. So this aligns, this specific competency, CUSIN Standard of Informatics, aligns with hallmark number 1-2, engaging our students. We want to instill and really encourage our students to be committed to innovation, continuous quality improvement, and excellence. So here's two questions that you want to consider. First, in what ways do the students observe for areas of quality improvement within systems and suggest appropriate solutions? So how often are we engaging with our students in a way that they are able to apply these expectations centered around innovation and technology? We want to introduce unfolding case studies in our classroom. We also want students to bring their firsthand experiences into the classroom. Encourage them to talk about how they're using technology, how they're using innovation, and then create an assignment where they're actually using it. That hands-on experience with application and analysis is going to advance students' comprehension of concepts. All right, and then the next question to consider is, what ways are students incorporating technology to make improvements in their performance? Are we using the digital resources that are available to students for free, perhaps? I know there are so many resources, as I mentioned, but even when we think about the medical terminology resources, there are so many apps that are free. Even our medication and drug handbooks, even some of those can be free. So just think about how we can leverage using technology, not only in our classroom, but with our students in a clinical setting so that they can have that information handy right at their fingertips. Of course, we always want to be compliant with our healthcare partners' policies and procedures regarding usage of technology. But if we're able to leverage that from a clinical standpoint to increase the student's performance, that's a great strategy. A second consideration is going to be in the classroom. Are we utilizing digital textbooks? Now, I realize for some students, they may still want the paper, and that's an option we can certainly give them. But using digital textbooks and other digital resources, introducing that in the classroom can help advance students' ability to use other technologies because it increases their familiarity. All right, so next we want to take a look at the definition of the CUSIN domain related to informatics. It's described as the ability to use information and technology to communicate, to manage knowledge, to mitigate error, and to support decision making. Think about the importance of reporting adverse events through technology and our ability to really engage in a root cause analysis by reviewing the data. And it oftentimes will expedite the reporting process as well. instead of our colleagues having to hunt for paper forms like it was 10, 15 years ago, they now have the computer system that's always available for them to report any adverse events or even near misses. We're able to create a culture of increased awareness and decreased punitive actions that are taken. That's when we have an increased reporting. Now we know we want to make sure there's a balance between reporting and adverse events and maybe practices that should have been different. But by instilling this culture of increased awareness and accountability that includes leadership and educators, so we're removing our barriers or barriers that may be in place for our nursing colleagues at the bedside, it does promote collaboration and increased reporting because there's less fear associated with punishment or behaviors that will be managed. So one example for knowledge is having students explain why information and technology skills are essential for safe patient care. A skill could be students being able to respond appropriately to clinical decision-making supports and alerts, okay? So making sure that they're responsive to these alerts that they may see come across or that they may observe when they're in the clinical setting. And then A, attitudes, students being able to demonstrate value associated with technologies that support the clinical decision-making, error prevention, and care coordination. The essentials domain that align with informatics include domain 8, informatics and healthcare technology, specifically domain 8.3E, using information and communication technologies and informatics processes to deliver safe nursing care to diverse populations in a variety of settings. And then we have skills, domain 8.3 specifically, using information and communication technologies and informatics processes to deliver safe nursing care to diverse populations in a variety of settings. So that's 8.3B and 8.3F. And let's talk a little bit about the skills and how we can best support our students when it comes to delivering safe patient care. I mentioned earlier creating a culture of reporting where we want to award our nursing team members, and not just nursing, but any team member in the healthcare setting that is reporting a near miss or an adverse event. That is going to establish a culture of not only reporting and safety in reporting, but also it creates a more safe environment for providing safe nursing practices and safe nursing care. And when we talk about an adverse event, making sure that we're following the evidence-based standards where we're debriefing, right, in a timely manner, where we're talking through what could have been done differently. It all starts with the reporting process. So we just want to make sure when we talk about delivering safe nursing care that we're creating an inclusive experience where our healthcare partners, including our allied health, our CNAs, so our support team members, including them as appropriate when it comes to adverse event reporting, just to make sure that we haven't missed an important step of that root cause analysis. All right, and then next is attitude. So taking a look specifically at 8.3, where again, communication and documentation, that's where we gather the information from about changes we may need to make to ensure that we are providing the safest patient environment that we possibly can. What are those education, or I should say, teaching and evaluation strategies? We've talked about a lot about the educational part, but now we want to talk about how do we evaluate and ensure that students are learning from these technologies that we are adding into the learning experience. And that's a really important point that I want to make as well. It's always great and often fun when we can integrate different technologies into the learning experience. And it's really important that we map whatever technology we're using to the learning objectives, okay? And there's alignment with the program outcomes. We want to make sure our technologies that we're choosing to use have a purpose, that it's not just all about fun and students being able to engage in different types of learning, but we've got to make sure there's alignment and there's purpose and that they are, whatever activities are, hopefully content related. So electronic references is one step. So using these resources, these digital resources to help ensure that the medical terminology, dictionaries, drug information books, as I mentioned, lab test norms, making sure that we are integrating and utilizing these electronic resources, digital textbooks and resources, presentations, and take a look at this. Less is more. Now, I know it can be hard. I know it's hard for me too, to limit the amount of content that I'm putting on a presentation slide. And we know that engaging our students and making sure that they're still attentive to what we have to say can be a challenge on some days. Even the most innovative, creative, engaging faculty can sometimes see students drift off and disengage. So in an effort to decrease the likelihood of that, we do want to minimize the amount of presentation content that we have on a slide, but also even the amount of slides that we have in a class. Okay, so less is more, and we want to role model that with our students. Audience response systems, or ARS, this is another great way to engage our students in the learning process in a different kind of way. The primary resources you want to use are going to be the CUSIN, AAC, and Crosswalk. Billings and Halstead, let me give you a couple of pages. Okay, so starting on page 89, this is where you're going to see a really good introduction to the concept of technological advances and how they, and from a historical standpoint, how they have affected our learning experiences, even how we craft what our teaching plans are going to look like. So start on page 89, the first paragraph, and even if you want to go back a little bit further on page 88, this is where it introduces the content around high tech, and then it goes into some of the other additional resources like the work that was done by Jones and Fulton in 2018, where they recommended that we as educators develop curricula that incorporate health information technology competencies so that our graduates are computer and information literate and capable of applying this knowledge to the management of patient care. So I'd be curious to know how many of you already have integrated a reporting system, a computer reporting system, even if it's just an overview with our students in your curriculum. So are we talking about the importance of reporting adverse events or even near misses in our curriculum? Is that part of an objective or a specific module that we're covering in our program? So I'd be curious to know that. If you're able to respond here on this YouTube episode, or if you want to respond in the chat if you're watching this in real time, that would be great to know. We always appreciate hearing from you all how you are aligning any of these evidence-based practices into your curriculum and into your everyday work. And then next we want to talk about the connected classroom. I think it's wonderful that there's a whole chapter 20 in Billings and Halstead, that is dedicated to describing the connected classroom. Now you may wonder, what does that really mean? What is that all about? I had the same question. So when you start on page 377, it really does outline many of the strategies that we're all familiar with, but I like how they've termed it the connected classroom. So starting on page 376, you see the introduction. The connected classroom uses digital technology to connect students, faculty, experts, patients, and virtual clinical experiences to facilitate learning. The key to the connected classroom is interactivity. Okay, we know that the connected classroom can improve student engagement. It can increase the amount of feedback for learning and provide opportunities for application of course concepts and clinical experiences. Okay, so we want to think about how we're connecting our students with the technology. Okay, how we're again bridging that gap, as we saw with our thought-provoking question, between the students' didactic experiences and the actual clinical experiences. All right, so those are some resources you want to use, of course, in addition to the NLN CNE Blueprint and the NLN Hallmarks of Excellent document. All right, so now let's go back to our thought-provoking question, and let's see how you all did. So let me switch my screen so you all can see the presentation slides again. All right, so now you can see what our thought-provoking question was. So these are also our resources. We've talked about them throughout our time together on this journey of looking at alignment between the CUSIN standards as well as the NLN competencies for nurse educators. and the essentials. Our objective has been that you all will be able to demonstrate alignment with nurse educator competencies to increase application and analysis. If you're on the journey to C&E, at least 70 to 80% of the questions on the exam may show up from that application and analysis level. Okay, so you want to make sure you're equipped with the basic foundational knowledge you need to ensure that you answer the questions correctly. Well, we've heard you all loud and clear when it comes to the busyness associated with your ability to study for the C&E review. So we were thrilled to announce just last week the new release of our C&E review on the go. And you can actually scan this QR code and it will take you directly to the actual app. All right, so this is a way for you to stay updated even in your busyness of trying to balance your workload and prioritize, because we know that life continues to happen and we want to be able to maximize the time that we have, whatever free moments those are, to review content if you are on the journey. All right, so what was the best answer? You guessed it correctly if you chose A, assisting in bridging the gap between theoretical knowledge and the clinical experiences that students are having. All right, so if you chose B, help increase student performance, the reason why that's not correct is because we don't know if it will increase student performance or not. Student engagement in the classroom, yes, there's data to support that, but not necessarily performance. We hope so, but there's no guarantee. All right, and then C, enhance the use of printed textbooks. Well, we want to leverage and enhance the use of digital textbooks, okay, and other resources in order for students to truly embrace technology and for us to do a good job of role modeling that. Here's another thought-provoking question that we wanted to leave you with. Okay, so what we want you to do is take just a few minutes to debrief from our discussion today, and we want you to write down what your thoughts are using the resources that we've identified, again, starting on page 377 in Billings and Halstead through 381, that's chapter 20. So take a look at this thought-provoking question, okay, or discussion. We have Dr. Jones. She's teaching the Health Assessment Skills Lab for the first time. She's reviewing the steps associated with the insertion of a Foley catheter. She has identified that 70% of her learners are auditory visual, and 50% of them are struggling to demonstrate all of the steps in the process. So the thought-provoking discussion I want you to consider as you debrief from our time together today is what types of innovative technology could Dr. Jones incorporate into the lab experience? Okay, you can again use the resources to help you discover some of those opportunities. We hope that this discussion has been helpful, and we appreciate y'all joining us on this journey where we have aligned the CUSIN competencies with the A8CN Essentials and the NLN C&E Nurse Educator competencies. This work is really important when we think about how to increase students' engagement in the learning process related to quality and safety, as well as ensuring that we are aligning all of these competencies with our program outcomes. All right, so until next time, you can reach out, info@drsellerseducate.com, or you can review our website to see all of the programs we have available to support you on your journey. Thank you all for tuning in today. Have a great day. Bye-bye.